Assalamu alaikum, Professor Ibrahim Hussain here from Pakistan. Today I'm going to share with you the management of lid tumor involving parts of both upper and lower eyelids with lateral canthus. When such a tumor is excised, a gap is left in both lids which needs reconstruction. In this case, fish mouth flap is needed. Here is a 65 years old male with suspected basal cell carcinoma involving the lower eyelid, lateral canthus, and part of the upper lid. It was decided to excise the lesion along 4 mm normal skin around and reconstruction with fish mouth flap. This flap is taken from below and above the lateral part of the ipsilateral eyebrow, and incision resembles the open mouth of a fish with two flaps extending towards the central point. Here you can see the lesion with markings 4 mm away from the margin. The tumor is excised in toto along with markings using surgical scissor. After excision, gaps are left in both upper and lower lids. A fish mouth flap is designed along the eyebrow as shown in the diagram in green color. This flap is shifted down with lower flap covering the lower lid gap and upper filling the upper lid gap. For this purpose, first of all, I marked the flap and gave incision along the markings. Then I elevated the flap by undermining the skin until I reached the base. Then I shifted the flap down over the lids. Here you can see the fish mouth shaped flap. The lower part of it will cover the lower lid gap and the upper part will cover the upper lid gap, while their junction forms the lateral canthus. The flaps can be trimmed accordingly and stitched to their respective lids in two layers using 6/0 vicryl. Ideally, posterior lamella should be constructed with mucous membrane graft, but even without constructing the posterior lamella, results are good because conjunctiva grow to some extent on the undersurface of the skin graft, although there is some fibrosis. After reconstruction of lids, the gap from where the flap has been moved is sutured using 6/0 vicryl continuous suturing. There are other surgeons who use interrupted sutures. That's it. Here is the look at the end of the surgery, which is not very impressive, but few days after healing, the appearance becomes acceptable. This is 15 days post-op pic of the patient, which is quite good. Here you can compare the pre-op and post-op look of the patient. Thanks for watching this video. Please subscribe the channel.